Hello, my name is Clara Kim, and this is my presentation on the case study for the University of Virginia's Medical Center. This is for the HAP 725 Statistical Prostate Control course at the Health Informatics program at George Mason University. So the source of data, we found it through the cms.gov website. This was a public website that provided all the information that we needed to pull. And the patient type that we focused on was patients with heart failure. And then the list of measures that we were looking at were unplanned hospital visits, the mortality rate, readmission reduction, payment and value of care, and Medicare spending. So one of the limitations of data was that it wasn't available for all years. So for some of the measurements, I had to go back further. Instead of 2018, 19, 20, 21, I had to go back to 2014, 15, 16, 17 to be able to pull the data for those measurements. So one of the other limitations of this data was that it was not risk adjusted. It would be more beneficial if the data was indexed because the observed rate over the expected rate would be more beneficial because it has more of a risk adjustment built into it. The measures that we have were more of rates, and these rates give more of a vagueness to the information that we're giving because there is no risk adjustment built into it. But yeah, for further references, it would be much more beneficial to use indexed and have risk adjusted built into these charts. So another limitation of the data was that CMS only provides information for Medicare and Medicaid. So it wouldn't be overall of the hospital's heart failure patients. It would be mainly just only those affected by and through Medicaid and Medicare patients. So that was one of the limitations we had when pulling data. According to my preceptor, these two hospitals were actually the best to compare to regarding its hospital competitors to UVA. So instead of three, this case study only has two competitors, Innova Fairfax Hospital and VCU Health Hospital. It shows the comparison of unplanned hospital visits for heart failure patients between UVA Hospital and VCU and Innova Fairfax. It shows that the UVA hospital's rate was actually not unusual as it fell in between the limits of VCU and Innova Fairfax. There does seem to be a small blip in the year 2021, but this could be due to the multiple reasons. It may be suspicious, but it's better to wait more years before making any assumptions on this blip alone because it's most likely to be not be a meaningful change. It's more likely to be maybe a change in a definition or data flow, or maybe something that happened to the data itself, but it's not a real and true change in outcome. And so it may look suspicious, but from judging from these 4 years, it doesn't seem to be much of a red flag. But otherwise, everything seems normal for the UVA hospital. So next we see the comparison of mortality rate from patients with heart failure. This shows the UVA's mortality rates for patients with heart failure over time, which judging from the chart is not unusual because when compared to VCU and Innova Fairfax Hospital, UVA does not perform exceptionally better or worse than them. It falls in between the limits, so it is deemed as normal. So this is a comparison of excess readmission rates for heart failure patients within the three hospitals. So it looks like when compared to VCU and Innova Fairfax that UV has a significant higher rate of excess readmission rates for patients with heart failure. So this is an export chart of the comparison of payment for patients with heart failure. As you can see, UVA is much lower than the control limits between VCU and Fairfax Innova. However, this is also mainly because Fairfax Innova is such a big hospital compared to UVA. It's a much bigger hospital scale, therefore their payments are much more greater as well. And of VCU and Fairfax Nova combined, it would be even more greater than UVA, which is why the control limits which is why the UVA hospital is not within the control limits of VCU and Nova. And so this is a comparison of Medicare hospital spending per beneficiary. The Medicare hospital spending includes heart failure patients, so that is why this is one of the measurements for this. As you can see, the UVA score is much lower than VCU and Fairfax and Nova, but again, this is because of the greater scale, more patients, more spending, more payments for a bigger hospital, in this case Fairfax and Nova. So when combined with VCU, they're supposed to be much higher than UVA's. As for a summary of findings, when looking at the data and plotting the charts, I found that from 2019 to 2020, the number of cases and rates were almost identical for all three hospitals, meaning like UVA's 2019 and 2020 were the same. VCU's rates or cases for 2019, 2020 for certain measurements were the same. That's why the data points from 2019 are usually identical on most of the charts. And UVA, when looking at overall data, UVA's hospital stays within most of the limits of VCU and Fairfax and Nova. Therefore, it is not abnormal. There is nothing showing that they're doing exceptionally better or worse than their competitors. However, for payment and Medicare spending, UVA did fall outside of the limits, but this is usually due to a difference in the number of their denominators, because VCU and Fairfax Nova combined are just such a larger scale than UVA. And that was my presentation. Thank you for listening.